Like it's not a natural process, ma'am. They can't get pregnant naturally, but you are helping them to get positive, and you are making their lives beautiful. So how do you feel about that, ma'am?
So that is the thing which actually makes you go for higher knowledge and skills also, because when you see somebody who has already gone to maybe many hospitals for taking treatment for fertility or conceiving and have not ended up with pregnancy, when they come to you and when you are able to help them and they get the baby, so it is something that what you have really worked for, it's giving you the results. So definitely it is.
Are there any such cases, ma'am, like a couple who struggled a lot with other centers and everything came to you and got positive? Any such cases? Can you brief them?
So one of the couple who had seen me, like they have actually undergone multiple IVF cycles, but some IVF cycles were completely negative, like unsuccessful, and 2-3 IVF cycles they had just beta HCG positive, what we call is biochemical pregnancy. So then it is like we call it recurrent implantation failure. So these couples actually they need extra investigations that why this is happening.
That means they are getting positive.
Some of the cycles were positive, but only blood test. They could not reach till the scan. So after beta HCG positive, somehow bleeding starts. So pregnancy cannot advance. So this is actually implantation has happened, but not advancing. But some of the cycles were also negative. So that is implantation failure. So basically these couples need extra investigations that why this is happening. So sometimes there might be immunological causes wherein your body's immunity is not accepting the pregnancy. So some of the blood test will tell us that if that is the reason, we have to add certain medications when after the transfer or even before the transfer. So that can be one thing. Then we sometimes have to do some surgeries to improve the chances of conceiving. So like we did hysteroscopy for this patient, and there were some changes which were suggestive of infection, chronic endometritis. So we treated her with antibiotics, and also we sent the sample of endometrium for testing to rule out any pathology like tuberculosis, because in India tuberculosis is very common. So luckily that TB test was negative, but chronic endometritis test was positive. So we treated with antibiotics. There were some reports which were abnormal in the immunological testing. So we added those medications in her transfer cycle. Then also we suggested the couple to undergo a IVF cycle with PGT. So PGT is embryo biopsy and testing the embryo for genetics. So if I know that embryo is genetically normal, that is euploid, then the chances improve of embryo to get implanted and also to progress normally, the pregnancy to progress normally. So we did PGT for her. So after PGT, out of 5 embryos, we could have 2 embryos which were euploid normal. So we decided, because it is euploid, more chances of implantation, decided for single embryo transfer. So that is more safe. So twins, there might be some higher risk of miscarriage or preterm delivery. So when we are putting single embryo, that we can reduce that risk. So when it is single embryo, it's more likely it will get implanted. So she conceived and the pregnancy continued, and then they came back with the baby after delivery. So this was about the interesting case. Also there might be some patients who have had some surgeries like endometriosis surgeries, and they have tried multiple IUI cycles and all. So for those patients also, when we do IVF and when we use medications to suppress their endometriosis, the implantation chances improve. So some patients have come with like fluid in the tubes, what we call hydrosalpinx. So even in IVF, this hydrosalpinx, that fluid in the tube, can affect implantation and can even cause miscarriages. So this patient had hydrosalpinx, but it was not diagnosed before. So when I did the scan, we could pick up the hydrosalpinx, and so we suggested after we make the embryos to undergo laparoscopy and hysteroscopy. So we did a laparoscopy to clip her tubes so that the fluid doesn't come into the uterus and it will not affect the implantation. So we did laparoscopy to cut the tubes. After that we planned her embryo transfer. So that patient also conceived. So it's like basically a combination of diagnosing the correct thing, that based on scan or some extra test when people have multiple failures, and then accordingly suggest the things which will improve the chances. So all patients may not need PGT, all patients may not need surgery, but if we pick up the right thing for the right patient, then definitely even if they've had failure, the chances will be improved.